Good afternoon. This is the House Appropriations Committee. It is Thursday, February 26th, 2026. It's just after 1 p.m. And we have Chair Wood back with us from the House Human Services Committee, this time to talk about their committee letter. So welcome. Nice to see you again.
Thank you. Thank you very much. You want me just to dive in?
Everybody has the letter.
Theoretically, I guess.
Yeah.
Okay. Great. Well, first off, thank you. Thank you for the opportunity to share our thoughts and process that we use to develop our recommendations. I think, as I noted in my cover memo that, we certainly recognize in FY as we're moving into this new fiscal year that the state's economy is shifting and one-time dollars are drying up, and that we needed to be mindful of that in making our recommendations. In doing so, we really did prioritize the basics of food, shelter, and safety for those individuals for whom we have responsibility in House Human Services. We, as we sort of talked about, began the discussion this morning, we made different priorities than the administration in a few areas. And in those areas where we made different priorities, we found sources of funding that included what the administration was hoping to spend the money on. So some of our offsets are from things that are already in the budget, and we have offset them and chosen to prioritize, for instance, in DCF prevention. And it doesn't mean that we are eliminating some things, but we are reducing some items. So I just, and as we go through, I'll point those out to you.
Great. Thank you.
The other thing is that while we are not recommending any cost of living adjustments for any community providers, we recognize that that really means that's a cut, because essentially in order to provide the same services and deal with the rising cost of inflation, we recognize that that's a tough decision, but frankly, we could not find offsetting cuts for the amount of money that would require for the providers in our system. So you will not see any recommendations for any COLAs here, but I just wanted to acknowledge that that doesn't mean that that's okay. The other thing that we have done is to point out a couple of areas where they were not items in our committee's jurisdiction, but they definitely impact individuals and recipients and Vermont citizens who are within our committee's jurisdiction. So the House Human Services Committee noted that the administration had eliminated $1.5 million in the Department of Mental Health budget that was allocated to designated and specialized service agencies. Now, those funds, they were for Reach Up recipients, and they were actually transferred. Those funds were transferred from DCF to DMH several years ago in order to fund essentially mental health services and getting people access to Reach Up and also dealing with their mental health issues. And it specifically has funded case management and other interventions for mental health supports, essentially prior to them becoming sort of officially eligible. And it is something for which, honestly, there had been no discussion. And we felt that that was a critical support, and it had been funded by DCF. And so we are making that, and there's more than 400 individuals that will not receive services as a result of that. And that's a current level service. So I know as you have worked through the budget, you've seen many adjustments to current level services in order for, the budget to be presented as you have seen it. An additional cut in the Department of Mental Health budget is $650,000 for the Community Resource Center in Chittenden County. And that is operated by the Champlain Valley Office of Economic Opportunity. You can see the data there at the bottom of page 1 and onto page 2 of my memo that talks about the services that they have provided. These are particularly vulnerable individuals for people who are homeless. Essentially, they've been accessing these services through a program that CBOEO has operated since the pandemic. And it has had a bit of a varied funding journey. Originally funded with federal funds and some funding, I believe, from the city of Burlington through their federal funds. When those went away, the COVID era funds went away. The funds were provided by the Department of Mental Health. And you may recall, because there was a lot of discussion about this last year, and it was on the sort of chopping block last year as well. And the department, I believe, came up with some funds to continue it through till the end of this fiscal year. It's a critical service in Chittenden County. And so if people think that the issue of homelessness is already bad in Chittenden County, this is going to make it considerably worse. You can see that there's 2,100 unique individuals served. This is a place where people are safe during the day. It's not nighttime or overnight, but they're safe during the day. They can get a hot meal, they can get mental health supports. I just feel like it's a critical thing, but it was not in our jurisdiction, but I felt I would be remiss if I did not mention it.
So we have a question too.
Yeah, and did the department, do you ever speak with anybody from the Department of Mental Health about why this got?
No, we did not. I did highlight it for the healthcare committee.
Yeah. And it didn't come up in our conversation with the Department of Mental Health when it wasn't listed as one of the things. And I think that's because it was kind of hard to find. At any rate, thanks for highlighting this, and I share your concern about it.
And I want to go back to page one. You mentioned, we sort of skipped over it, and maybe it'll come up later, but the housing proposal, the housing initiative that they're calling, and I know you're working on a bill and it's going to be within the same budget. So will you be recommending that we just take all of those housing things and keep it, we would account for it in the budget, but we would keep all the money together in the bill?
Yes, and DCF has identified, it's in a few different places.
Yes.
In their budget, but we did get a spreadsheet from their CFO, Megan Smeaton, and I think Nolan has a copy of that outlines FY 25, 26, and then 27 proposed for their spending both in general assistance emergency housing and OEO programs. And so that is all shifting in 27 to different things,
Right.
but they, including staff positions, and they show that history so we do have a spreadsheet that shows that total dollar amount. It's 80-some million.
Yes, 82 or something like
Yeah.
that. And I think, Nolan, some of us have a copy of that, but I'm not sure all of us have a copy of that. So we should.
So yes, you will see when we get to the chart that we did not make any recommendations. We said this is pending action on a bill that's still under consideration.
Okay. Great. And that you're hoping to get out by crossover on the 13th or something?
Yes, ma'am.
Just checking. I know
Yes.
some things yeah.
I would be remiss to say that I'm not guaranteeing success of that bill. And I so need to, I guess, alert the committee to the fact that we will, if we are unsuccessful in that bill, we will need to have policy in the budget as we have had for the last few years.
Yeah.
Which I think will probably raise some of the same concerns. One of the things, I'll tell you, one of the sticking points right now, I will say up front, is that the administration's proposal removes the adverse weather conditions as it has been, which is essentially December 1 to March 31. And wants to revert back to one day you're in, the next day you're out, maybe 2 days later you can come in and the next day you're out, essentially based upon the temperature of the day. It's not something that my committee will agree to. And it's not something that we have been doing. It is something that was done prior to COVID. It's very intensive, staff intensive to operate.
I think so.
Very. They're asking for 21 positions in their proposal. Frankly, I just don't think it's humane during winter months to be putting people through the ups and downs. And we don't house everybody who's homeless in the winter months. I want to be clear about that. But we do it within the budget that we have. And so I'm just putting that out on the table because it's going to be an issue in the bill that we have under development, and it will be an issue in the General Assembly's budget. So if we don't have a bill, that same issue is going to come to the table in the budget. And so I just think it's fair for me to alert you to that.
Yeah, no, thank you. That sounds a little destabilizing. Tom?
How much budgeted for 21 people? You know?
For the 21 staff, it's 2.1 million, I believe.
So that's people that they're not going to be reassigned from many positions. These are theoretically 21 people to be limited service.
They have been limited service in the past, and they're wanting to make them permanent.
And they'll work where? I'm sorry.
The proposal is in economic services.
This is part of what we've asked JFO to do, is to get us the list of all the positions, because they're taking everything from the position pool. So they're saying there's no new positions, maybe technically, but we don't know. So it isn't showing up. Usually in the budget, we have a section that has all the positions, because those are new positions that are not in the position pool. So at the moment, they're taking everything from a position pool, but they're scattered throughout all the agencies and the departments. So we don't really have a handle on all of them. You know, there's 12 here, there's 21 there, there's 6 here, and that's what we're going to get a handle on. So JFO is working on that for us. Yeah.
So, no, I'm going to pass.
Okay. More to come. Wayne and Mike.
Economic services,
I'm sorry, I didn't hear you, sir.
what departments are?
In Department for Children and Families.
Thank you. And I want to thank you for pointing out about how humane this is, or that it isn't. And I hope that would guide us here. You know, we have child abuse laws in this country because we had animal abuse laws first. And it was the Massachusetts Society for the Prevention of Cruelty to Animals that brought the first suit that led to child abuse laws. Because we had a policeman saw a child get beaten and there was no law against it. And they said, you can't beat your horse, but you can beat your kid. And I hope we can treat fellow humans more humane, or as humane as we treat our animals. Thank you for pointing that out.
So I just felt it was, you know, I wanted full disclosure that
Yes.
what will be an issue in the bill is also going to be an issue in the budget. So it's going to be an issue wherever it is
Right.
that we land.
Okay.
Okay. And then finally, we're not really sure what's happening with SASH. You know, we've heard that that it's budgeted someplace. We couldn't really tell. It's in Dale. The administration is the administrative costs for SASH appear in the Dale budget. Those are funded. But
Administrative costs are funded?
administrative costs are funded in the Dale budget. I think it's 5.1 million in global commitment for the actual services, you know, out in the community. we've heard different things, and I just wanted to highlight it for you because again, that's not in that's in the healthcare
We
committees.
heard about it from Chair Black.
Yeah.
This morning, but I did not know that the administrative costs were actually already in the budget. So they're funding the administration of it, but not the people who do the work. Okay. And then
we have some significant concerns regarding the high-end system of care. That's how it's referred to in DCF for youth in custody who may have had some issues with law enforcement or behavioral issues. And Representative Donahue has really been dogging this for at least the last 3 years. And I've included a copy of her memo to the committee so that you can understand the sort of the depth of the concern that we have. And we are, taking kind of a bold step and saying, we really feel like we need to understand what we are committing to in the long term. And that was a question, frankly, we asked of every department where we saw things happening. We asked the same in the Department of Health with regard to recovery residences. So we're very happy to see that in the Rural Health Transformation Grant for the development of these new residences. We've been asking, so do you have a plan for their continued operation?
Right.
Because that doesn't fund continued operations. Do you have a plan for continued operations once you've developed, all these new recovery residences? We haven't gotten clear answers about that. I'll just be honest. They have smart people working there, so I'm sure that they're thinking about that. But as a body, I think we need to understand what we are committing ourselves to in future years.
Exactly.
That is getting locked in this year.
Right.
And
Right. And it may sound like not very much this year, but it turns out to be 5 times as much 2 years down the road.
Operations tend to be, I guess more expensive depending upon what it is. So, and that's where coming back to the high end system of care, the contract that DCF has right now for the place down in the sheriff's building down south is $4,000 per day per child. That is more than inpatient psychiatric care at Brattleboro Retreat.
Right, isn't it Brattleboro Retreat 2,300?
It's something like that.
800, yeah.
Yeah,
4,000 a day per child.
per child. And that's with an organization that the state of Pennsylvania canceled a contract with because of concerns over treatment of the children. So, we have a high level of concern about this. I'm not exactly sure what we can do about it, frankly, but, we really feel like they should be renegotiating that contract. And we feel like we need to have an understanding of, so do you intend to continue this service if you have a youth campus someplace? And we haven't been able to get the full picture.
Yeah.
And this is not without trying to get the full picture. We had language in the budget last year about it. And there was, I think, language the previous year. We're still trying. I think it's not only a policy decision, but it's a real significant money decision because it is extremely expensive and they've had difficulty getting bidders. And, we do hear from other witnesses, and we're upstairs taking testimony right now about this, that there is a belief that there's a better way to do things. I think that everybody recognizes that we needed some level of support for youth who used to be at Woodside, we're sending too many kids out of state now. We're just not sure that we've, hit on the right package that's affordable for us in the long term. So So that's the last thing that's in the package. So
Okay.
now let's just turn to the chart.
Yep.
Oh shoot, I didn't do it in color on my printer.
Ours is a couple.
So you will see, and this is just organized alphabetically. So the Department for Children and Families, the Child Development Division, there are a number of changes here that we are concurring with. But the biggest one, which I'm sure you have already noticed, is a $6.2 million bump into the Child Care Financial Assistance Program for Child Care Financial Assistance from the general fund. So what that is telling us is that to date, at least, that there are insufficient revenues in the child care contribution to cover the expenses of the program. And I might recall for you, last year's budget was attempting to transfer money out of that fund.
Right.
And we fought against that. This is one of the reasons, you know, the program had not been fully implemented. We've been through now 1 full year. It is doing the things it was intended to do. We have double the number of kids. We have 1,200 new slots that have opened up and more still in development. And the program now is an entitlement, which it did not start out to be. That's not how it left our committee. That's a $6.2 million increase into the program from the general fund. Some of these other things are decreases. So you'll see the Strengthening Families Program is being cut by 1.1 million. There are funds available through funds from Act 76, which is the child care bill, as well as the child care capacity grants. They're reducing those, and as well as emergency financial relief for child care providers and eligibility agreements. Efficiencies were used a lot in our budget testimony from the department. So you probably have heard the same thing. They found some savings through efficiencies. So we are concurring with those, recognizing it's keeping the program whole. It's making some, reductions in some of the services, but we do not feel it will have a negative impact on the providers or the staff. We received a request. This is not I've turned to the next page. Sorry, the pages aren't numbered. I just realized that. We received a request from Parent-Child Center Network for $1.88 million. I'm sure you heard from them during your budget testimony. It was a variety of increased expenses. And we are recommending $180,000 just for the concrete supports, which is the direct support for families at risk. So, things like helping them get a winter tire so they can get to their work, or, examples like that.
It means real tangible stuff.
Exactly.
Okay.
Exactly. And so again, we've highlighted the place that we would take that from, school age childcare. So we are providing you a source of funds for that.
Net neutral to the general fund.
Exactly.
Love it. Thank you.
You'll see, we do that in several places. There are a few that don't have it, so
Yeah, no, I understand, but
spoiler alert,
it's
but
great when people can figure out a way to make that happen. Wait.
What was your thinking on?
Times are tough for families right now, especially low-income families, and we could not find our way to funding the full 1.88 million. And because part of that was for COLA increases, and I did a chair thing, to be honest. I said, we're not doing COLA increases this year. And part of it is for something you'll see me talk about a little bit later, the benefit assisters, which I know that you've heard some testimony about. So that 180,000 will be direct financial support to families for like it's a variety of different things. It's not any like one thing. Concrete supports is something that's a term of art in the parent-child center network and in community action and
I wanted to hear your thinking on, reducing the childcare for, putting it into parent-child centers, the rationale for, one being a priority over the other.
well, we aren't, we're moving from 2 million to 1.8. So we're not eliminating, it, we're just taking that 180,000 and so it's not going to result in any decrease of access for school-age children. Move on?
Good, yeah.
Okay. The Family Services Division. So again, we saw the department focusing on the high-end system of care that I was just talking about a few minutes ago, the very expensive high-end system of care. And pretty much kind of decimating prevention services. And from a policy perspective, that didn't make any sense to us. Because obviously we want to prevent child abuse from happening. And we want to reduce the reliance on those high-end systems of care. How do you do that? You do that through prevention. And so the Nurturing Parent Program at Prevent Child Abuse Vermont was slated for $194,000 cut. And we restored that funding. And again, we reduced line item, you can see there, which is the high-end system of care by that dollar amount. And then Nolan can describe to you that part of that is GC and part of it is general fund. So it's not like a one-for-one kind of thing. And we were also just barely told that the River Valley, which is the new program in Southern Vermont, may have carry forward. So that we believe that this can be done without any harm to anybody.
Because that's the part of the high-end system of care.
Exactly.
Yes, they should be fine. Okay.
And you'll see the same thing in the next line item. So they had proposed cutting almost $294,000 out of post-permanency program. That impacts the Lund Center, Easter Seals, and I can't remember what the third one is. NFI, thank you, kind sir.
That's the, remind me what NFI is, National.
Northeastern Family Institute.
Okay.
And so, again, we are saying that we should restore that full 293,000 and that it would come from the high-end system of care line item. Again, a mixture of GC and GF there. And again, they have told, DCF has told us that they may have carry forward for River Valley because it has not opened yet.
Yeah, Marty.
Do you know what the full amount of the post-permanency program was? If this, well, I guess I can figure it out. 25% was the 293.
Well, the way DCF described it is that it was a cut to the non-DCF custody, kids who had been previously in DCF custody. In looking at the actual numbers, it didn't turn out to be that. So I can't tell you, Marty, but I could get back to you about what the full amount of that post-permanency is. This essentially,
And you cut.
yeah, I'm not sure it's 25%. That's what they said, but I'm not sure that that's exactly what it is. And this is the money that it's essentially almost the same amount. I just recall from last year, we put that money in. Remember, there was a big discussion about, I remember going round and round about this with Emily Byrne and how the money was allocated and was it because there was money that was left over from the previous year and there was a whole shebang about how it needed to occur, how it needed to be presented in the budget. And this is essentially the money that was added last year. Yeah. And then we did not object to the post-adoption consortium cut. be honest, I don't know what the consortium is. And then on the next page is something that we feel very strongly about, and that is the supervised visitation. So we're looking for, and this is not something that was presented in the governor's budget. We're looking for 249,000. And this is also involves some mechanics. The Center for Crime Victim Services has in their budget 137,500. They have written to us and indicated that that money should be transferred to DCF because it really is the Vermont Network Against Domestic and Sexual Violence that sort of manages this and not the Center for Crime Victim Services. So they are okay with that. Director Pullman, I have a memo from her about that that I can forward if you'd like. So that's just a transfer, okay? So and then there's 249,300 that we are recommending. We asked for a report on this last year. We heard the results of the report this year, and we have this desert in the middle of the state, Washington County, Orange County. I don't remember if it's part of Lamoille, but kind of in the center part of the state, that where there is no supervised visitation available. So it is very difficult for non-custodial parents who are under, typically have a court order for supervised visitation. Very difficult for that to occur without these services. And we also have lost some services because this has been underfunded for quite some time. So what this is recommending to do is that it will stabilize the 6 existing sites, and then it would start to fill in that gap in the center of the state where there's no programs that exist, and it would open two programs or 2 sites where children and family could have supervised visitation. And we are recommending this to come from a source that we have tapped previously, result of tobacco settlement funds quite some time ago that have been sitting in the judiciary for CHINS related services. We feel this is an appropriate use of those funds. And you'll see, we have language about that.
I'll pause you for a second and then I'll get you there. Nolan, do we know how much is in that special fund? It's Chin special fund?
There is money there, we should talk about flood.
Okay. Yeah, just, we always like to know what's in special funds. That'd be great. Wayne?
Talking about supervised visitation in prisons, right?
No,
What is?
no, supervised visitation is, so when there is a custody issue in the courts, and there's been allegations of mistreatment, maltreatment, whatever, against one parent. There's
DCF has children.
DCF has some of the children, not all of them. But the court orders supervised visitation. This happens in the community.
I understand this. I didn't know because supervised visitation is not a.
Oh, in the court, yeah, this is not in the court system at all. No, not in the court system. Okay, ready. So then we're moving on to economic services. This is where we're going to kind of breeze by economic services because we are going to deal with this in our bill, which is still under consideration. So that's really all I have to say about the first part.
It's in, oh, these are the governor's recommended decreases?
Yes.
The 7.1.
Yes.
These are still all TBD based on your bill.
I can say that we are concurring with the things that are not the 7.45 million GA. Okay, the other ones we are okay with. And then we come to another item that was not in the governor's budget, and this is one of the items for which we have not identified a source of funds for. And I'm just gonna bring us back to what I said that our committee focused on, which was food, shelter, and safety. And this obviously comes under the category of food, and that is Vermont Food Bank. And I know that you were seeing requests from other parts of our General Assembly, and they've pretty much divided up their total request of $5 million, which we support in total. The $2 million that they're asking from our committee is direct food purchasing for community partners. So as you know, they're the distribution site that helps to keep the community partners, your local food shelves, your local food banks, local senior centers all over the state. So this is, the 2 million is direct food assistance to communities. And we also are reporting that we support the Ag and Food Resiliency Committee's request, and what hopefully was in the emergency food distribution, which should have been in the government operations. Yeah.
So yes, we have heard that the 5 million total to 2. So you're supporting all of it.
We are supporting that.
Okay.
And as I said, I'm sorry we couldn't come up with a place to take it from. Okay, and then we are seeing several different decreases in the next item, which is essentially reach up. And we are, while we're concurring, we need to raise again the issue that these are very low income, sometimes no income, single parents, essentially. And the cost of living has continued to rise substantially, and there has been no adjustment in this line item to bring it up to current dollars in many years. And so I would just be remiss if I didn't say that although we're concurring, we're doing it with a heavy heart, because we know that these families could benefit from a reduction in the rateable reduction, which is roughly 50%. So just as a reminder, so they calculate what we should give, and then they reduce it by 50%. And then it's based on old, outdated information. So it's not even based upon the cost of living for the most recent year, the most recent data that's available.
Where they're using housing data from
Yes,
2001.
yes.
So what is process for changing that? What do you bang your head against the wall on every year to think of, how can I make this, I mean, this goes on with the federal levels of poverty not changing and whatnot. So, I mean, it strikes me that if they're going to, on a very surface level, if they're going to cut the money and keep it at the same level, as opposed to make, like saying, oh my God, we're using less, but we need to pay more, it's.
Yeah, I mean, what they're seeing is a reduction in the caseload, which I suspect we'll be starting to see increases in, because it follows the economy. And, what we would like to do, obviously, is to reduce the rateable reduction and update the data on which the calculations are made. That requires.
Who does that?
It would be the General Assembly. I mean, it can be proposed by the administration. It hasn't ever been since I've been here, but we've not had the will in the General Assembly to do that. And it's a giant hole. I mean, it impacts very low income single parents.
How many of these people do we know are are without homes?
I don't know that specifically. I think that number is contained on the report we get on a monthly basis from DCF.
Okay.
The number of families who are homeless who are also reach up participants. And of course, we know what the cost of housing is. And there's nearly 850 children as of December who are homeless. And that's, that's in this state, and we can do better than that. But we're not.
Can we update that metric, the language here from 25 years ago to the current?
There's been calculations. I'm trying to remember if it was last year or the year before, that we asked for a calculation that would update the, reduce the rateable reduction essentially. And we do have a report from DCF that I think is last year, I'm not
Yes,
positive.
you have,
Yeah.
maybe it's on your committee page. I remember seeing it. You must have
Yeah.
it in your report section. So I would say, let's take a look at that and then. Okay, wait.
Where are the 850 homeless children? They're not obviously.
850.
Where are they?
Yeah,
They are, I don't know exactly where they all are. A number of them are in hotels right now. And
Shelters.
some, yes, we have some family shelters.
we don't have a lot.
Not enough, right?
Not very many.
Just, I'd just like to have a general idea.
Well, we do have it by county because DCF puts together that information. And Rutland County is often the biggest
Rutland County has a lot, yes.
Those would be in hotels, because they got hotels there, right?
or not.
Yeah, this data is from, the coordinated entry assessment process. We frankly believe it's an undercount, because this is people who have gone through the coordinated entry assessment, which is a, 25-page long assessment. And that means that you have to be in a place where somebody's been able to find you and do the assessment. So that's why we think it's an undercount.
That's why I was asking, because if we know these ones that we've counted, they either have to be in a hotel or some shelter someplace, or they have to be in some facility that
That we know about, yeah.
we're involved in,
That's right.
right?
I just don't know where each 850 are. I mean, the coordinated entry, they call it the HMIS system, the homeless management information system. All of that data is in that system, and they can provide reports about, where you were before you were homeless, where are you now, that kind of thing. I just don't have that off the top of my head. So, I raise concerns about that, and I hope that we can do better, frankly. The next is, I'm gonna just make a brief statement. This is the Office of Economic Opportunity at the Department for Children and Families. Again, this is pending a separate bill that's still under consideration in our committee. And I did note in the cover memo that there are no plans in committee to go over the governor's budget or under the governor's budget. So
We'll match the.
we will match the governor's budget. Yes.
Okay.
My guess is it won't be exactly as you see it here, but it will be in some of those same areas. Okay, and and when you turn the next page, that's where you can see the 21 limited service positions, the 2.2 million. Okay. There was a proposal to decrease Vermont 211 coverage by 332,000. And we are, I want to make sure that people know that it would no longer, as of July 1, be 24/7 service. It will end at 11 p.m., I think. And 211 reports that they believe that is okay, given the call volume is not very high during that 11 to 7 a.m. period. And so they want to focus on being able to update their IT system and to really have staffing during the 6 to 10 p.m. Time slot that is really quite busy. So we are okay with this decrease because the House Healthcare Committee is recommending that it be backfilled with some mental health IT fund that they have over there that they're talk to you about. I don't know exactly what it is.
We heard that. It's,
Yeah.
I guess a question.
I think our suicide hotline goes to a national
Yes.
number if there's nobody there. Is there something similar we can do with this?
They have been contracting with a company out of New Hampshire for their overnight. They're part of the national 211. I don't know, when we took testimony, they didn't actually talk about the capacity to do that, out because it requires access to the database that's very Vermont specific. As opposed to, the 988 that is, you're there trying to help a person through an emotional issue. So I'm not aware of that, Mike. Sorry, Representative.
Okay.
Okay, sorry. Okay. The next thing is something that is a little out of the ordinary. And this is a specific request for peer-directed services for people with very significant disabilities, people who are homeless. This is for an organization called End Homelessness Vermont. They had asked for more than this 600 and some odd thousand. We did reduce it. But this is very specific disability-focused case management and placement services for people that, frankly, most of the rest of the systems that we have in the state have given up on. And they've been very successful in finding permanent housing for those folks and getting them stabilized, and getting them access to emergency housing if necessary. And we were, frankly, quite blown away by the endorsement from 15 different organizations that came forward in writing and said, this work is valuable, we need this work, and these people are doing good work. And it is life-saving is what I want to say. And I think that you're familiar with, we have identified a source of funds for this, which is in DCF. They have over $11 million of carry forward funds from FY25, a lot of which has been obligated, but not all. And so we are recommending that that be used and tapped to provide funding to this organization.
And Dave, you have a question.
Well, I just wanted to back up what the chair said. I had an opportunity to speak to several of the staff affiliated with this organization, and they know their stuff. I was very impressed, and I'm not easily impressed in this area. Very informed people who knew what to ask and could dig deep. Thank you for highlighting this.
Wayne.
This seems to be an attempt to address some of the issues that we discussed last year about parsing these people out in places where they had the services that they needed in the
Exactly.
with the bad folks that may be causing them trouble.
Yes, exactly. And the one thing that I want to stress in this is, people who have been chronically homeless, or who have significant medical issues, mental health issues, other disability related issues, people who've had amputations and who have been, for one reason or another, not able to access housing, emergency or otherwise. This organization, meets them where they are. And when they meet them where they are, they have success. And I'm going to be frank, the administration is not a big fan of this organization. So I'm just being frank about it. But we felt compelled in our committee that with the support and recommendations from these wide-ranging other community partners, that given the state of homelessness in this state and the success with which this organization has had, that we felt compelled to bring it forward specifically. And it would need a specific appropriation, which again is a unusual thing.
So I have Wayne and then.
Tell us what the objection is.
You would have to ask the Agency of Human Services for that. I don't want to interpret what there's,
Justified that to you.
yeah. I can tell you that there have been some people who said like, well, they're not a 501c3 organization. They have a fiscal agent. They've provided us with all the documentation for the fiscal agent. They're registered with the Secretary of State's office. So they've provided us all of the information that we felt was necessary in order to meet our due diligence to, you know, sort of like the making sure it's a real business. Do you know what I mean? So, you know, in terms of objections, I think that it would be helpful if you wanted to.
Like a concern that they might be for profit.
They're definitely not for profit. Yeah,
That could be-
definitely not for profit.
A lot of non-profits around.
Yeah.
Even if they're not non-profit, there's a lot of non-profits. Lynn?
Yeah, I think I was gonna ask the same thing. 501c3 means it is a nonprofit. It's
Yes.
Registered with the Secretary of State. So they're not registered with the Secretary of State.
They are registered with the Secretary of State as a business. They have not gone through all of the machinations to get their 501c3 status yet.
Fiscal agent is.
Their fiscal agent is Vermont Kin, Vermont Kin, I think is what it's called. It's essentially, it's an organization that is a 501c3, and it provides support to family as care providers. So like when grandparents raise their grandkids, you know, and have custody, take custody of their grandkids, it's an organization that's been around in Vermont for a long
So
time.
that's a requirement for state money.
Well, you have to be a registered business, which they are. And, you know, as a policy, I think, for human services, we prefer to contract with nonprofits. So that's why it is, their fiscal agent is a nonprofit.
It's called Vermont Can, like CAN.
K-I-N.
Kin, I wasn't sure which way it was. Okay,
2/3 of our nursing homes are for-profit.
yes, that's a good point.
Dave, you don't want to get me going on nursing homes.
yeah.
I don't want to get me going there, Dave. I am pretty sure about that. I'm sorry,
Point of
Representative.
reference, Dave, we appreciate that. Okay, so 510, 625, 511, 625.
I have one question. Do you have any idea of what the pool of disabled homeless people are? And
Yes.
how much this $500,000 can help?
I can get you the exact number from the report that we get in terms of the number of the vast majority of people who are homeless have a disability. It's
Quite some
a lot. It's a lot. So this is not going to help all, you know, all the people who are homeless in the state who have a disability. But I just don't have it with me. I have the data about the number of people who have been served and what this will do. Yeah.
I was thinking more of, you know, a severely medically disabled person, if this organization is trying to get them into permanent housing.
Yes.
And hopefully they get into permanent housing, but how many more do we have to help next year
Yeah.
that are out?
Right, right. And this is where the numbers were that 82 people who qualify were put into permanent housing. 2 of them fell off, which is a pretty low rate of recidivism, or I don't know what you call it there, except 1 is then since found a home. So there's only 1 out of the 82 that is back.
They've been very successful. And part of the reason they've been very successful is that they continue with follow-along case management services. So we then don't find people becoming homeless again, which, you know, the data that is in our homeless management information system is there's a very high rate, over 25%, of people who have been placed into permanent housing, then become homeless again. And part of the reason is because they don't have that same kind of continuity of case management and support. And then the organization also, you know, they step back when they need to step back, you know, as people gain their strength and they gain their stability. And as they have a never ending influx of new people who are referred to them. So, and some of our community action agencies refer to them. Some of our homeless shelters refer people to them. So I feel like this, honestly, our whole committee actually voted in
I'm
favor
just thinking of
people.
future. Anyway, so they're gonna come back next year and
Well, you know, what I'm hoping is that in our homelessness array of services in our bill, that we can address peer-supported options. And, you know, I think the research is pretty clear about peer support, whether it's in recovery, whether it's in homelessness, whether it's in mental health, whether it's in other disability services. Peer supports are very successful because people have been through it. They've been there. They know. Yeah, yeah. Thank you. Moving on to the next section.
Yep.
Okay. We're now changing departments. We're going to Dale with Department of Disabilities, Aging and Independent Living. And this is the other place where we were not able to find a source of funds. But keeping with our theme of food, shelter, and security, we are recommending $1 million in general fund for Meals on Wheels. As you can see, nearly 1 million meals have been delivered in this state on an annual basis. And the average cost is nearly $13.50.
One meal?
Well, that counts the meal, it counts the support for drivers, the volunteers, there was a whole cost study done for it, yes.
2024 rate study.
Yes, it's 2024 rate study. So what we have right now is a mixture of general fund, GC, and Older Americans Act money. And you might recall last year, we didn't ask for new money, but we asked for the department to get in to seek global commitment funds in order to match what we had already put in.
Right.
We made a choice this year not to match it with global commitment because it's under the investment line, global commitment investments. And we have, you know, heard some concern about global commitment investments for the future. And so we didn't want to risk putting something in there, increasing it, that's going to get taken away. Yeah. So, and again, this still, as you can see, there's you know, across our state, $11 million in Meals on Wheels goes out the door to thousands of Vermonters. And our state contribution to that between, well, state and federal funds right now is 4 million. So this would up that to 5. So there's still considerable amount of fundraising that happens at the local level to support Meals on Wheels programs across the state.
Right, so this proposal would increase it to 5.160.
Exactly. Yeah. The next items are things you'll recognize from the BAA. And that's the annualization of the in the FY26 BAA to restore rates for ERC level 1. And so this is the full annual rate.
Those are global commitment numbers.
That's GC, yep.
I know when we can get the actual numbers, the general fund numbers.
Yes. And the same with the next item. That was for the area agencies on aging case management rate. For some reason, they weren't included when everybody else got the 2% last year. And we put that in the BAA. And so that, excuse me, again, is global commitment. Excuse me. I have some here. Yeah, thank you for the prompt to drink my own water. That's good idea, Teresa. Okay. The next item is home share. I think everybody here is probably familiar with home share.
Gave them this amount last year.
Exactly, in one-time dollars. And so we are proposing, one, it's been very successful, which is good news. 2, it is one of our lowest cost approaches to homelessness in the state. And 3, it's serving an underserved area, which is the Northeast Kingdom. And, you know, so if we don't do this, essentially what we gave them to start that last year, they would have to stop doing. However, this is where we're going to see in the next couple of items, you're going to see recommendations to reduce choices for care by, in this case, $560,000 because home share, as far as I know, is not matchable. So in order to come up with $235,000 general fund, it would require a $560,000 transfer out of global commitment in choices for care.
Does that free up some global commitment for other projects or programs?
Well, it would free up the federal side of it, not the states. It would still need match. Yeah. And you'll see this in the next item as well, and the next two items. And, we are not doing this lightly, but these are all elements of long-term care, and Choices for Care is a long-term care service. But some of these things are not within the confines of Choices for Care, but we're making a policy recommendation that these are just as important. And as you know, the Choices for Care is several $100 million. And we really didn't feel like these relatively small adjustments are going to impact the overall program or any access to services in Choices for Care. So much as we were discussing this morning about, yes, in the governor's budget, they put it all into Choices for Care and they didn't fund these things. We're saying we don't disagree. Choices for Care is good. But we think that part of that money should be utilized for these services, much as what we were talking about this morning, and we'll talk in a minute about in the health department. Okay. So we are recommending that, what we started last year, that we continue.
For the ombudsman, is that 110,000, should that be GF or GC?
They said that they use GC. I didn't verify that, so.
So we use GC for the healthcare advocate, so I'm assuming we can also use GC for.
Okay.
They go into nursing homes and Choices for Care, Medicaid, they're ombudsman for Medicaid services.
Okay.
So they requested 275,000. We said no, because frankly, part of that was COLA, and we had made the policy decision to not do COLAs. But the $110,000 is specifically for one staff person, and it is really for the extra caseload work that they have been encountering. It probably is not going to, maybe it will surprise you, maybe it won't, but when people try to solve issues without having to go through a formal complaint process in a nursing facility, they utilize the ombudsman services, and they quite often can remediate the situation and get the person the support that they need. One of the examples that was shared with us is in one of our for-profit nursing homes. The hospice services had ordered a certain level of medication. The patient wasn't getting that level of medication for pain relief in their final days and hours of life. And the reason was because corporate said that they couldn't do it. So family members intervened and they used the ombudsman, and they were able to quickly resolve the issue. But that's the kind of stuff that we're seeing. And that's the kind of thing that these people do. And one of the things that they, in order to be efficient, they are locating their staff in different parts of the state. So for instance, I think in Bennington, you're familiar with the relatively, new home that we pay a premium for. I'm trying to remember the name. I can't remember if you can remember the name. I know, it'll come to me after I leave it, but
Okay.
we pay a premium. They are serving people with mental health challenges, people who have moved from the infirmary and corrections. They have served a few homeless people. But it's going to drive me nuts. I can't think of their name. So they are locating, the ombudsman program is locating people in various parts of the state to be very efficient in not, sending somebody from Burlington to travel 3 hours down to Bennington. We supported the staff position. And again,
I had a question.
That's Vermont legal aid. You get that someplace else in your.
Yeah. So you're saying this is at Vermont Legal Aid? Is that where
this is in Vermont Legal Aid, yes.
I'll have to look and see who's in legal aid? You do. Is this yeah, go ahead.
Legal
Bill.
aid is a separate organization. You
That's
take a
right.
contract, they're separate contracts, so HCA, the healthcare advocate would have a contract. The long-term care budget would have a different contract.
Yeah.
The Medicare one that you saw, that's a different, these are all, mental health has different contracts. They're all
It's not different organizations, though.
same organization, but they have individual contracts.
Right, so they're for different programs.
Programs, yeah, they're different programs.
It's not state agency.
So we are-
That's part of the request that we made to start putting, to get a chart from James about what all those contracts are and what the monies are, so that when we have these conversations about legal aid, we can now check them off, but
Sounds
understanding
like
full
no
well
one can
that.
help with that.
So
So,
our agencies are contracted with this non-governmental agency for things.
well, legal aid is in statute. So they're quasi-governmental. I
We've
don't
got a
know
lot
what they
of
are.
things in statute that might not should be here.
Well, whether you think it should be, where it is. Okay.
Okay, so that's why, that's only a 1-for-1 because that's GC to GC,
Yeah.
okay? And then we move down to, this is something that, I don't know if you had any testimony on it at your budget hearing, but there are, a relatively small number of Vermonters who are both deaf and blind. And they require, assistance to access their communities, frankly, because they, obviously they cannot drive. And they need, special interpretation services. If you've never seen it, it's quite remarkable, actually, so the interpreter is signing. The person who is deaf and blind is like touching their fingers as they're signing. I'm like, it's remarkable to me. I could never imagine, the ability to do that. But, so there has been a really small, funded program at Dale, that, has been zeroed out of the budget, $150,000. And again, these are people with very significant life-changing disabilities. And for this 150,000, we are recommending that be fully restored. And again, that Choices for Care, the several hundred millions we have in Choices for Care, be slightly reduced by $326,000.
Had for a long time.
I can't remember how long, but it's been in effect for a while. Yes. Yeah.
I recognize Choices for Care is a really large program. For these previous 3 sections, is there a certain place that would affect the program? Would that simply
In
be?
one budget.
So just would be spread across provider rates essentially?
No, it would, they build in caseload increase, in the budget. So it would, it's not going to reduce provider rates at all. Providers will still get the same rates. Nursing homes are still going to get their increases. We're not increasing any of the community providers, I'll point out, but we are increasing nursing home rates. That's all accounted for in the budget. So it essentially makes a little bit less available for caseload increase, if you will. But it's just, Choices for Care is just one line item in the budget. But we are proposing to change that.
That's right. I think we've
So
heard something like that.
the deaf and blind, that's not their entire appropriations. They're getting more money than that. Is this just a part of it?
No,
It's all, it's the
Yes.
entirety. It's this.
yes.
Okay.
Okay.
Continue.
All right, now we're moving on to the Department of Health. So one thing I realized after our discussion this morning is that I did not make note of the decrease in the special fund for the substance use prevention special fund. So I'm going to ask you to make a little note in there that it's not included, but it should have been.
In Department of Health.
In Department of Health. So our intent is, as you heard this morning, to reduce the Department of Health's request for increases in those two areas. And instead, like we just recommended for Choices for Care, we're recommending different priorities. So instead of the big increases for the local prevention folks and the school-based stuff, we're saying that part of those funds should flow to the folks that we said this morning, and then you'll see the recovery centers were funded out of that last year, and they weren't recommended this year.
Just for the benefit of this committee, can you describe the difference between a recovery center and a recovery residence? Because we're used almost interchangeably and they're different. Yeah.
So recovery residence, or recovery housing, however you want to refer to it, is literally, some people call it sober housing. It's essentially peers together, living together under a commitment to remain sober. And it's a like a peer supported environment. They do get some, depending upon the level, there's different levels of recovery housing, and those different levels require increasing services as you move up through the levels. So at the very basic level, it's just essentially peers residing together. And then as you move up the levels, there are additional supportive services like employment and case management and things like that. Recovery centers are essentially what I would call sort of day program kind of sites. They're only during the day generally, but sometimes they're open on weekends. And they are places where people can go to get referrals for other services. They're places where people can get peer support during the day. I think this morning when we were talking about substance use, substance use and substance use recovery is it's an iterative process. People go through ups and downs and life challenges along the way. And the recovery centers provide that support to people during the day. And they give them access to resources. For some people who are homeless, it's a place where they can be safe during the day, and to access the support from, again, they are generally peers. And the recovery residences and the recovery centers really are integral to one another. And it ends up providing access to 24-hour support when you combine them together.
So 7 million decrease now. The rural health transformation grant may come through. Deal with some of that, but we don't know when or what the timing is going to be. And I assume that with no positions, decrease in 7 million, that's not affecting positions that are planned. These are tuition and grant kinds of things that money's for, right? So shifting those around, my question will be, understanding that, if that's correct, what happens if we do this and the transformation money doesn't come or comes late? Will it affect anybody in terms of loan repayments or anything like that?
The answer is yes. And the answer also is, I want to say what they report is that they believe that this will be for the tuition and loan repayment, that they believe that this will be eligible. It is an item, but we also have heard testimony several times now from the AHS Medicaid director that they are learning new things every day about the strings that might be attached in something that they thought was going to be one way and turns out to be something different, or it didn't quite match up with what the intent was. So I have to tell you, Representative, that I think that the jury is still out.
So what, the reason you're asking is because if we commit to that, and something happens, it's delayed, or the strings attached don't allow it to come, does something fall through the cracks, would we be better off to postpone this for a fiscal year till we know that we've got the money coming in from the new program?
Well, we wouldn't be opposed to you putting back in 7.5 million.
I don't know.
I mean, if you're recommending that, I'm not going to oppose it.
Oh, yeah?
No, but you see what I'm thinking, and make sure we don't step in a pothole that we don't want to step in.
Yeah, I think that there are two different things here. I want to make sure that, so there's the AHEC, okay?
Which we heard about from this morning.
Yes, and we are supporting the Health Committee's recommendation to restore that funding. And then there's the loan repayment fund.
Right.
That.
VSAC.
Yes, I think it is through VSAC. That the legislature actually initiated to help deal with the healthcare professional crisis. And the health commissioner, I cut him some slack. He was like, I don't know, maybe a month on the job when he testified in our committee and was just learning about all of this stuff. Yeah, Representative, I think that the jury is still out about all the specifics for the Rural Health Transformation Grant is all I can say, but that's what they reported.
Yeah, Jill's coming on the 10th.
Okay.
We're gonna get an update, but Nolan, what do you know?
For record, all I will do this goal. So while there's stuff around workforce in the proposal, it's given CM, not different.
It is different, yes.
It is different. And I believe, and I'll let Jill confirm, they have heard that you can't use the rural health transformation for loan forgiveness. So.
That's what she has testified in our committee as well, yeah.
So this program, if it goes away, it's not being replaced
Okay.
by RHTP. There's other workforce development things that are in RHTP, but it's not a one-for-one.
Right.
It's different, so.
Yeah, okay.
Exactly.
And we'll have a better sense.
Exactly what Nolan said.
What he said. Okay.
Okay. And then, the next one was just that was a spending authority issue. It's not a big deal. Actually, probably shouldn't have been in here. And then, the next one we just, talked about in terms of, the priorities in the governor's recommendation. I just realized that number is wrong. It's $3 million.
Is it 1.2?
Yeah, their increase is 3 million and change.
Someone's gonna get us a chart of various stuff, what we talked about this morning with the opioid fund and this fund and what the governor recommended and what's being recommended by Human Services. So we're gonna get ourselves organized.
Okay, all right. I apologize. That dollar amount is not the right dollar amount. I think what that dollar amount represents is the 800,000 plus those 4 programs that we are recommending in 660. So, but the governor's recommend is 3 million and change increase. And what we're saying is that, roughly half of that we believe should go to other priorities. And I do want to highlight the recovery centers. They were funded out of the Substance Use Prevention Fund last year. And there was no recommendation from the administration to do that this year. And we think that they are vital to recovery. And so we said that we should continue what we did last year. That's essentially just level from last year.
With the correct dollar figures, so we don't have to do more. That's gonna be the problem. The budget adjustment.
Oh, right.
You'll see we have language.
Okay, great.
Yes. Okay, so next we have this other category. I think you probably heard in testimony benefit assisters, and then I'll be wrapping it up here. This is a cross-organization collaboration, and you probably didn't hear from all of them, but there are 16 different community partners representing 46 different organization sites across the state. This proposal is a direct result of HR1 at the federal level. And we didn't have time to calculate whether some or all of this could be matchable, because some of it is about Medicaid, access to Medicaid. Some of it is about access to SNAP, / 3 squares. So we are recommending that this be funded. And I just want to give you an illustration of what's happening right now in the next few days, and why this is needed. So we received notification from DCF, I think it was last week, that they have mailed out notifications to some 2,100 individuals who are no longer going to be eligible for SNAP, 3 squares. And they have been unable to reach them in time to talk to them about how the paperwork that they need to do in order to continue their benefit. This is exactly what we are afraid of. And so while it was predictable, we are actually seeing it happen March 1st. So there's going to be 2,100 individuals who received that notification that they are no longer going to be receiving SNAP benefits. They're going to receive that, or they have received that.
Unless they call in, correct?
Right. And so the point is that we can prevent that from happening. These are a cadre of organizations that you probably were given the list of all the organizations. If you weren't, I can give it to you. But they represent everything from United Ways to Community Action to parent-child centers to ones I had never heard of, to be honest with you. And they came up with a very detailed list of, a 0.4 FTE or, 3.2. I mean, it's not just a willy-nilly kind of thing. The group has worked long and hard on this. And I have to say that I wasn't like an original supporter of the concept, because I felt like this is what the state's supposed to be doing. But I have been convinced, honestly, that the state is investing, and you have seen in your budget, they are investing and having to invest in the extra requirements for the state as a result of HR1. So in DEVA, for instance, they're having to add staff because they now need to do things twice a year instead of once a year. And, so that exists in all of these areas. And, but there isn't a focus, honestly, other than what I call normal and customary, in terms of outreach to individuals. And those are the people who we need to really be concerned about.
Moreover, the same re-eligibility requirements for Medicaid apply to SNAP. And as I understand it, there hasn't been any additional staffing recommended under 3 squares.
Not that we could tell. And like I said, there's staffing increases across AHS mattered here and there to deal with the increased requirements on state government to meet the requirements in HR1. But is the citizens of Vermont who are going to actually experience the shock. So I have become convinced that this is a good investment. And since it's directly related to HR1, we are recommending, you can decide something different, but we're recommending that it come from the 50 million pot of money that was set aside in the FY26 budget.
Interesting proposal. Thank you.
And then finally, again, this is something that was not in our purview, but impacts the people who are in our purview. The Department of Mental Health budget eliminates the Chittenden County Community Outreach Program. We've heard compelling testimony from the Essex librarian, from municipal employees. The Howard Center has provided significant support to those sort of like what I would call entities who are now becoming places where folks who are homeless, they come if they need a warm place or they need a place to be during the day and they don't have any other place to go. So the library testimony was actually pretty compelling, and they, without prompting, and we weren't even taking testimony about this particular program, they just kept talking about whenever we need support, we call the community outreach people and they are there. So we concur with the House Healthcare Committee's recommendation to maintain that to maintain that program. And that, Madam Chair, is the end of our recommendations. However, we have a few pages of language.
Okay.
Let me just briefly review those with you, because I'm sure that I probably used up more than my time. Choices for care. I think certainly Representative Iacovone is very familiar with choices for care. This is a budget. This is a program that started some 30 some odd years ago. I was at the department at that time. I helped implement the program. It was a magnificent design, still is a magnificent design, that enabled the state of Vermont to utilize the same priority for community-based services as we do for institutional-based services in nursing facilities. And it was very innovative. And what the premise of the program was, let us reduce that. Premise of the program is people would prefer to receive their services in their home and in their community, and not in a facility by and large. That has been proven true for a long time. And the premise of the program is, if we have this all in one budget, then as the nursing home utilization decreases, we can invest those in the community side and increase the community side of services and supports. And that has been extremely successful in being able to do that. And I don't have the data off the top of my head, but we have taken offline several hundred nursing home beds over the course of this period of time. And we are at the place, frankly, we do not want to lose more nursing home beds. We do have an aging population. Nursing homes are serving people at the higher end of the age spectrum, people in their 80s and 90s, and you've got even some centenarians out there. And they are serving people really with more acute needs than they did 30 years ago. And so we don't want to reduce nursing home beds any further in this state. And in fact, the Dale commissioner testified in our committee that, we may actually need to increase nursing home beds. The problem with them all being in one budget line item is that the money is only flowing in one direction now. You've seen the EFR payments and the automatic increases for nursing facilities, which I don't want to place them in the jeopardy that we have community-based services. Trust me, I don't want to do that. But I truly believe at this point in time that the facts support that we should be separating these two budgets now, because it is not, they need to stand on their own and not have what we need to spend on nursing homes being subtracted essentially from the community-based side. It leaves less available for the community-based side.
This would be more transparent to do it.
This would be more transparent at this point in time. And, I talked to Dale about this. The business manager at Dale is not particularly thrilled about the concept, because he states the obvious. There's still, the bulk of the money is going to nursing homes in the Choices for Care budget. So his contention is that there's more opportunity, if we leave it together, for that to flow to the community side.
How often has that happened?
It's not. Have you ever seen a nursing home rate go down? No. And we don't want to reduce the number of beds. That's the only other way that
Right.
goes down. We do not want to reduce the number of nursing home beds anymore. And if, as the commissioner says, that we may need to actually increase it, if we keep this together, is not allowing the community-based side to stand on its own. And
It could be at the expense of the community-based services.
yes, I mean, that's actually what we have seen. And, you know, I think that, so I just wanted to lay that out. I think that the time has come to ask them to submit that budget in a way that separates those two out next year. And I did want to highlight for you that we had that discussion, that they, you know, wiggled their nose at it. They didn't really like it, but I can make a very strong case for it. Meal delivery services, we don't need to go through this whole thing, but the essential part of it is we need to find out a little bit more about what's happening with how many meals are delivered, what is being, what's been the administrative costs, and we want to make sure that the money, if it's approved. Now, some of these things are only contingent upon whether or not you approve our recommendations or not, but that it goes 100% to meal sites, not any administration. So we don't want anything being taken off the top for administration by the area agencies on aging. The meal sites don't get the money directly from the department. That goes through the area agencies on aging, and then it goes out to different meal sites. So that's all of what that is there, okay? And then we have our recurring HIV/AIDS language.
So this report, should that say home delivered on congregate meals?
And report, home delivered and,
Thank you.
yeah. Okay, so then we have the Ryan White HIV/AIDS information. And then if you want to flip over to, I guess, which is, what page is it? 1, 2, 3, the third page of language. It says Section E, Appropriation Recovery Partners of Vermont. This is where we make I will say, a very specific recommendation, so we don't have that occur, what happened this year. So we say, in accordance with the recommendation of Recovery Partners of Vermont. That's the 800,000. And then you'll see language on the supervised visitation. I'm going to let Nolan explain that, or Katie when she gets back. Because we wanted to identify what that money was being used for here as well, so that there was no question when the money gets to DCF about where it should go. Yeah. And then you will see our language around the high-end system of care and residential crisis stabilization. That coincides with Representative Donahue's memo that she has on the back. And then that's a wrap for.
Okay, and that,
Human Services.
really appreciate the work that all of you have done and that Rep Donahue has done, and I know that Rep Bloomley's been involved with that as well. The more you peel back the onion, the more you find.
Exactly.
Swing.
Let's take a look at it through section H, residential crisis stabilization. You want to shut the whole thing down?
What we want them to do is to renegotiate, and we want them to pause on creating a youth campus until we have a better understanding of what the long-term costs are going to be. Given right now, there seems to be an inability to recruit providers. And to remind people, the former high-end system of care was run by state employees, which was, that had its own challenges, but it has been difficult for DCF to locate providers. And frankly, it's been very difficult for them to cite. You might remember Newberry, and then you remember Virgins, and now we don't have a site. And so we are saying, since we don't have a site, let's take a deep breath and let's just reevaluate the need for this, and whether we should be spending, like, we don't know, for instance, do they want to keep this very expensive program in Southern Vermont at the sheriff's office and do this. Red Clover, which is in Middlesex, is supposed to be a temporary program. That's you know, temporary has a different definition to,
My point is,
yeah.
we want to shut down the planning part and tell them, don't do nothing until you get something done. Or do we just ship them out of state?
Well, they're already going out of state.
Because it seems like we have a crisis in this area of care for these people. We've got crisis there. We're not gonna move forward, you know.
Well, we have moved forward. We have 7 beds that we didn't have before. So we have 3 in Middlesex and we have 4 down in Southern Vermont. So those 7 beds we didn't have before. So that has been in response to the crisis that was created when Woodside closed. Frankly, we have just not been able to get out of the department, other than words, a budget that would let us understand what are we committing to on the long term here.
So in terms of the number of people needing the service at this time, are we taking care of those, or we're just shipping them out of state? We don't have a capacity, is that right?
Well, like I said, we have 7 high-end beds, and we have never come back from COVID to the same capacity for residential treatment as we had prior to COVID. Staffing issues have prohibited current providers from coming back to that. And so yes, there are youth being transferred out of state.
So do you know how much greater the capacity, how much greater the demand is compared to what we have for current capacity?
Well, the campus is, I have to go back and check, Representative, I have to go back and check to see. I don't want to misspeak because it's been a little while since I looked at the campus proposal about how many beds that they were proposing to be in this site.
We won't ever cover 100% of the folks that are beds because
Right.
we aren't going to build beds for all the different kinds of needs. So some are going to go out of state. Some of the issues here is the extraordinary expense.
Right.
That we are incurring with possibly disreputable organizations on top of it. And not understanding what the full scope of the cost is on an annual basis. That's part of what Ann was digging into, is trying to really understand what the costs are. So you should all read the memo. We're not going to go over it now, but you should read the memo, and then we will be having further discussions about this.
You know what my concern is? My concern is that we don't want to, I would hate that we stop and pause something too long and not move forward.
Right. Right. On the other hand, we don't want to be spending $4,000 a day per child in a sheriff's building for beds.
They spent $2 million on renovating it.
It's temporary. And it's
Well, it serves 4, so it's $500,000 per bed. But for renovation of an existing building. So there's just a lot of questions, and we just felt like it would be prudent for us to say, like, okay, let's just take, and the Office of Child, Youth and Family Advocate, has some serious concerns as well. And I believe that DCF is acting in good faith to try to address the issue of serving kids in Vermont. It's just that if you have, it's very difficult. I don't want to sort of second guess because I wasn't part of those contract negotiations, but
right.
It's an organization that has some history that's not so good.
You can Google it and find it.
Yeah.
So more to come on that. Thank you for all the work to you and your committee that you've done. It's always the most challenging, I know, getting this letter out, but it's really helpful to understand your priorities. And we'll do what we do.
And thank you for the opportunity to be here. And I certainly am available and want to appreciate the committee's attention. And I do want to in particular call out Rep. Bloomley because, she's been kind of a 12th committee member for us for a few times. And it's It's been lovely to have her consultation, so.
It's helpful for us too to have her be there, so thank you.
Alrighty, thank you.
Thank you so much. Committee, we're gonna just power through here. It's gonna be short. Chair Mahali has promised us he doesn't need too much time. We really thank you for your patience. And so we'll talk about the House General and Housing budget requests. Welcome, Chair Mahali. Did I say Mr. Chair? Is that what you want to say? I guess.
No, I'm standing between you and a break, huh?
A little bit.
Ask for a joke, but we'll just keep going.
Thank you, Madam Chair and members of the committee. It's a pleasure to be back, always for me, in appropriations, which was my first assignment here. I think what I'd like to do is talk generally about the approach we took in our letter. The letter, I want to tell you, because of an unfortunate attempt on our part to actually make the deadline that was given us, there is an error and there's more information that has to be provided.
You can revise the letter and send us a new one.
Yeah, all right. Generally speaking, there are very few types of housing left in Vermont, new or used, that most Vermonters can afford. It's that simple. And so we're doing everything we can in our committee to try to address that in admittedly piecemeal ways. But I mean, frankly, the only housing that's available in Vermont now that can be, the average Vermonter can afford is housing that is manufactured housing. And by that, I mean what you think of as single wides, double wides, and, you know, what we used to call mobile homes, if we have a bill on that. Everything else, in order to be affordable to a nurse or a teacher or a carpenter or you name it, needs some sort of subsidy. The problem is we don't have enough money. I mean, what you are going to be much more on top of the issue of how much money can be devoted to housing than I am, but whatever it isn't enough. So what do you do when you don't have enough money? What you do is you try to use other people's money.
OPM, other
Right,
people's.
it's absolutely essential. And so one of the ways we thought about when we tried to create priorities, we looked at, it's not just what this program does or that program does, it's how much leverage do they have? Do they bring in private sector or other funds, governmental funds from somewhere else into Vermont or into the effort? So in tier one, which is our highest priority, we just have highest priority and high priority, but the highest priority, we looked for programs that, to start with, that have high leverage. And I'll start right with at the top, although the array of programs in the tier one doesn't mean anything. In other words, one isn't more important than the other, to just the order we put them in. Let's talk about VHCB. The $12 million is simply, it's nothing more than what VHCB originally asked for, one-time funds. And of that, $3 million was for disability, to continue the disability housing pilot program. I'll just say a word on that, although I'm sure you'll hear more if you haven't from VHCB and others. We have a problem in Vermont in that just about a generation ago, we decided to deinstitutionalize people with developmental disabilities and return them to the quote community, end quote. What that meant, of course, was their parents took care of them. And their parents are aging out. Like me, I'm aging out. They're aging out. And so we have a real need to house these people. And the study indicates that we could use 600 units of housing, which would cost a great deal of money.
Right.
We have a pilot program, which is much smaller, that $3 million would allow the continuation of that pilot program. But I'm very well aware, as is said right in here, that I think we all know you don't have 12 $1 million cards to throw at anything. But I include VHCB in there right there because they are the quintessential example of leverage. For a $500,000 unit or 500,000 or 600,000, they put in 80,000 or so. Where does the rest of the money come from? It comes from private sources or from federal tax credits. There are two different kinds of tax credits, but one of them is essentially unlimited. They're just sitting there available to us without limit. But we have to put our money on the table. If we don't put our money on the table, we can't use the tax credits. So VHCB's kind of leverage, if you will, which is, I think, an interesting fact, it's kind of 4 or 5 to 1. So they put in 80 grand and we produce a $500,000 unit. I'm not saying you have to give them X amount of money. I'm just saying every dollar we don't have for that is $5 lost for housing. Those units are all kinds of units. I mean, BHCB funds all kinds of stuff, but they are new units. They do some rehabilitation, but they're largely new units, which we need a lot of in Vermont. VHIP is a very different animal. It's almost not, don't compare VHIP and VHCB. I mean, I don't know why people develop preferences for one over the other. It's like saying I like an apple more than an orange. They're just very different programs. VHIP is almost exclusively, they've done a few new units, but they're almost exclusively existing buildings. It's usually small, where the owner of the building wants to put the unit back online, but they wouldn't meet code. I mean, they wouldn't meet habitability. So they need an investment per unit. And what VHIP does is throw up to 40 grand into the unit. I think actually 50. Up to 50 grand into the unit. And if someone wants to make the unit ADA accessible, another 20. But in fact, what they've on the average invested is 40,000 a unit, which is not a lot of money. But that does not pay for most of the rehabilitation. Most of the rehabilitation, the landlord or the owner of the building is putting in just as much money, or maybe a little more. So the testimony we've received from people who administer this program is it's sort of a leverage of about 1.1 to 1. In other words, it brings in $1.10 for every dollar invested. And it produces a completely different kind of unit. It produces these units in small buildings, small owners, where they're rental and they're rented at what's called HUD fair market value. It's the fair market. It's much less than fair market. It's the 40th percentile of fair market. It's a number that is determined every year by county, by HUD. So these are people who for 5 or 10 years are guaranteeing that. And the interesting thing is, it's counterintuitive. One of our fears in our committee is, well, what happens after 5 years? Do you lose these units as affordable units? And there was just recently the first survey that's ever been done where they surveyed the landlords of the units, because it's now 5 years. So the first units were eligible to go out of the program and charge real market rents. 97% of the respondents, and most people responded, indicated that they weren't going to change anything. They weren't going to change the rents. They were completely satisfied. It was really interesting. I don't even know what to make of it, but I just wanted you to know. The problem with VHIP, which is a big problem, is one-time funding versus base funding. I am as aware as I can be without having actually sat on this committee recently that base funding is very hard to find. But I will say, we took a lot of testimony on this. I think this program, which has now been going for more than 3 years on temporary funding, it deserves to be recognized as a permanent fixture in the state. And that means the employees of that, other than the one who runs it, they've been kind of limping along on limited service contracts. At a certain point, they're going to start looking around for something else. And I think there's a good chance that if the program doesn't get itself into base in a more permanent status, that they'll lose their employees, and they don't have very many. So I don't think it's an overstatement to say that there is some very substantial possibility, which I can't measure, that this program will eventually kind of cease or shrink to just managing the existing units if we don't find a way to make it permanent.
I guess question.
I think when I was talking to Alex Farrell, that the administration is putting this in base now.
In their budget.
Yes.
Their budget is just their budget.
They're recommending,
Yeah,
they're agreeing.
yes, they're agreeing, yes, that's right. It's in their budget but I'm just saying, I agree with that. I'm just saying,
Too.
our committee came around to really felt that this is important. Last year, we didn't put it in permanent. The administration did, and I understand why we didn't. Permanent money is extremely difficult to find. I'm just saying there's a price now. I think this program's kind of limped along for 3 years. So the other thing that's really important that's in this tier is extension of the landlord tenant rental arrears assistance fund. And I want to say something about this that isn't on this letter. This is a fund run out of the Vermont State Housing Authority. It's a fund that we appropriated here. I think it was 2 million plus 2 years ago. It really it's directed at helping people who really can make it, but something bad has happened to them. Like they got sick, not permanently sick, but something that is stopping them for 3 or 4 months from paying rent, but they can pay rent eventually. This is not the person who just ran out of money and doesn't have any prospect. This is a person who does, but something bad has happened to them. What this program does is, once eviction begins, it allows tenants and landlords to vote. If the tenant is eligible, and that eligibility means can they eventually be counted on to be able to pay, then the state housing authority can give them up to several months rent, and it goes right to the landlord. So it's kind of mutually beneficial. Why is this? So we strongly advocate that program will run out of money in April. So we strongly advocate at least $1 million for that program. Why is it so important? Several reasons. One is, in this house, we are in, our committee has been wrestling with, and just by a vote of 8-3, voted out the landlord tenant bill. It was a very hard vote for everybody. It was not a partisan vote. Why was it so hard? It was hard because of situations we cannot control, which is the rental market is unbelievably tight, expensive. We don't have the most highly developed social safety net. Yet we have, housing is kind of a fundamental need, but we provide housing through the private sector. So the private sector has to function. It has to function financially. If it doesn't, then we start losing it. So the problem is that the number of homeless people is unfortunately slightly increasing, and the more evictions there are, the more homeless we're going to see. And that's very expensive for the state. It means the motel program or something else. It's very expensive. So if we can do anything on the homeless side to reduce the increase in homelessness because of eviction, it's really well invested money. It's paid back. The alternative is the motel program. So we think this program is a really excellent way to do it. It's aimed at people who can pay rent, but something bad has happened to them that's temporary.
I haven't read the latest version of the bill that passed today. Did it include extending the tenant representation program, which was also a program?
Legal aid?
Legal aid, and did it make it take away the pilot language?
No, that's a separate bill, and it's not in that bill.
It does the same things that you're just talking about.
Yeah, it does. It does. It's similar, yes. Yeah, it's not in the bill. It was voted out.
All right, thanks.
So that's important. We think that's like right at the top of the list. The only other thing, Madam Chair, that I'll say that isn't in here is something I know you're going to be wrestling with, which is the Section 8 vouchers. And it is my hope that we are able in the budget to have a small amount of money flowing to Section 8 vouchers. The reason is those vouchers pay the difference between what the tenant can afford and HUD fair market rent. In Vermont, the HUD fair market rent has been going up and up and up, so that the cost of a voucher has been going up and up and up. So even though we got a little more money than we thought from the federal government, the number of vouchers is going down, and it's gone down every year. And the federal funding for the next year, for in this case, 27, calendar 27, when they decide how much money they're going to give Vermont in 27, they will look at the number of vouchers that were outstanding and that were in use in 26. So if we can fund vouchers in 26 to increase the number, we'll get more money in 27 and 28, et cetera. Also, those vouchers, the project-specific vouchers, if I am a low-income housing provider and I want to build low-income housing units, and like any other developer, it has to pencil out. So I start building a spreadsheet, and in my spreadsheet, what am I going to put in for rent? I can't make the project work if I put in whatever the low-income tenant can pay. It won't pencil. I can't build it. The only way it pencils is if I can say to the housing authority, can you give me 10 Section 8 vouchers that I'm guaranteed? Then I know I can put in 10 units that will be at least at HUD fair market rent, and I'll make the project work. So that's happened. And right now there are 3 projects that are ready to build, literally done. Talk about shovel ready. I think there's shovels in the ground. But because of this Section 8 problem, the housing authority has been forced to renege. They've said, whoops, we can't give you the vouchers. So the programs are sitting there. These projects are just sitting there. So it is my hope that in your wisdom, you will find a way around this. The other high priority projects. Oh, the other is the Human Rights Commission. The Human Rights Commission is suffering like a lot of programs.
We had them come in.
Had them come in and talk.
Yeah.
Okay, well, then you know, I'm not going to repeat it. We think that there's an unrealistic assumption in the governor's budget, a small one. And we think that we should attempt to address the loss of federal funds. Madam Chair, I have listed a number of high priority items, which I don't think need that much explanation. There is only one or two that I'd like to reference at this point,
Okay,
and then happy to answer any questions.
great.
We have to provide some more information on a couple of them.
Okay.
One, believe it or not, is the Home Share Vermont.
I just heard about that from Chair Wood in Human Services.
Well, then maybe I don't need to say anymore.
But you are agreeing that
They need,
that's a priority that you have as well.
you know what's so great about that? Are you guys familiar? Well, you heard about it.
Yeah.
You know, I don't have the number off the top of my head. It's a low-income housing program. I never thought of that before I became familiar with them. We worked with you last year to give them funding out of the blue. We hadn't thought about it before. But when I heard about testimony about the program, something like 90% of the people who come into the home are low-income people. So not only are they saving money because they're helping the people who are getting older like me and need help doing whatever, they're also helping themselves with a place to live that is incredibly cheap. I mean, it's, again, hugely important. I guess the only last thing I'd talk about is the Vermont Labor Relations Board. Have you heard from them?
Yes, we hear from everybody, and I think there's a bill. Is this the one that has a bill? I think
It's coming to you, yeah.
We're hearing it tomorrow.
Okay.
We're not making money decisions tomorrow, but we're
Okay.
hearing the bill tomorrow.
The only thing I would say that you might not know is this. The Labor Relations Board has always had for a long time a mediator. It's not theirs. It was the Federal Mediation and Conciliation Service provided it for free. That's gone. So there's no mediator position and no that talk about leverage. Mediators save a lot more money than they cost. But the other thing that's happening that you might not know is this. We have on our wall, along with 70 some other bills, we have on our wall at least 2, maybe 3 bills that are taking things away from the Vermont Labor Relations Board, responding to complaints and saying that they can be dealt with privately. And when you hear testimony on why this is, it's because the VLRB is so snowed under that it takes months and months and even years to get to a decision. And so we felt that's not a great idea to take essentially a governmental function and turn it into a private one, because when the government does it, you have a coherent body of law that people can turn to as to what's happened in the past with decisions. But if it's farmed out to private arbitrators or nobody knows why things happen. But we put in a lawyer because we feel like they need more stuff. I think at this point, Madam Chair, I would be happy to answer questions, but the rest of our material, we will provide a redrafted letter. There's a mistake and there's some more information needed.
Great. Any other questions from Wayne and then Lynn?
Do you know how long those mediator position was lost?
This last year.
It was part of
It's part of
the federal reduction.
part of the federal reduction.
So had that,
Actually, what happened was the entire service was kind of defunded. And then there was litigation. And as a result, I don't know whether it was because there was a judgment or not, it was refunded to a minimal amount, but many of the people have left and the mediators were not come back.
so it was ongoing for quite a long period of time.
Oh, when I was on the school board in the 90s, a federal mediator would come in. It's been around for decades and decades. Yeah. Lynn?
Yeah, I have, this is really helpful. I've got a couple of comments. one of the concerns I have is that your highest priority seems to be skewed toward renters.
Although actually not VHCB, they provide a lot of home ownership opportunities. They do both. VHIP, I'm under the impression that almost all the VHIP units are rental units.
Yeah, yes. My experience with VHB, what I see in my communities, there are some things that are like condos, but most of it seems to be rentals, and they're not very big. So the question I have, and they're expensive to build.
Everything
I
is
mean,
now.
we have one that just opened in St. Albans, beautiful, nice new building, got all kinds of nice amenities. They're very small. I think the living space for the living room, kitchen area is maybe half the size of our smaller committee rooms upstairs.
That's
They're one of the
getting
big
pretty
ones.
small.
It is pretty small, with a 1 bedroom, and it's not exactly something that a young family or someone who's moving here who wants to take a job, who has a couple of kids, it's not a place that they can go to. They really don't want to go to it because it's not big enough, and it isn't how they want to live. Now, in this building, they cost $578,000 plus per unit. So a lot of money.
That's pretty typical for new
And that's
units.
pretty typical, yeah. And so the number one concern is, the question, of course, is why couldn't they build units that were less expensive and provide 3 times as many, number one. But number two, what do you do if you want to live in a single family home? You didn't really go into the mobile home or the double wides or the modulars.
Well, we do have MIR, but the mobile home rental program is on here.
Yes. But again, which is a start. The other thing is that, and I don't know, I haven't looked at your landlord tenant bill that you just passed, but it is onerous to be a landlord. Financially, emotionally, dealing with the issues you have. I suspect that one of the reasons why the VHIP people who are getting this money and fixing it up are perfectly willing to keep it the way it is because they probably don't want to make it into a single family home and they don't want to go and necessarily take the chances. If they've got good tenants, they keep them.
I think landlords want good tenants, and even if it's a little less than market,
They're happy.
they're happy, yes.
Actually, sometimes they keep the rent lower, so they keep good people.
Right,
They aren't really
yes.
interested in the,
I think that's true.
and I speak from that, from experience as a landlord. So the issue is, the issue is that doesn't surprise me, that they will keep good tenants, they will accept this, and they will try to keep as many good tenants in there as possible and help them stay. So I'm not surprised by that. But what else other than a manufactured home has your committee looked at in terms of single family, starter homes, things like that?
I think first of all, I understand your statement that it's onerous and difficult to be a landlord. And we heard a lot of testimony to that effect. One of the things that's so hard about working in this field is that it's also onerous and difficult to be a tenant. And there's a lot of, and sort of finding a middle ground there has been difficult. I would like to believe that we have, but I would be the first to admit that perhaps not. I mean, it's very difficult arena. That will come, you will have a chance to hear more about that. I think that VHCB, coupled with VHFA financing, does a lot of home ownership programs, and they try to meet markets. So very often, if there's a building with, let's say, a bunch of studios, 1 bedrooms, there'll be a certain number of 2 and 3 bedrooms, but it's their guess as to market and what the market is. And as to unit size, I think you'd have to ask more, you get more from VHCB than from me. But we're doing a lot in our committee trying to find ways to reduce the cost of housing and to bring it down. And I'll give you one example because it will come to you. At the end of our letter, as a separate section, I just wanted to alert the committee of what was coming down the pipe. So I have a section on what I call proposed legislation. That's on page
Oh,
4.
yes.
For your information only. This is legislation that I didn't want to just blither about that has money in it. And we have a bill, 775, which will come to you. We have a bill that is an omnibus bill trying to enhance financing for housing in rural Vermont, small housing projects. And I'll give you an example of one, which won't take too long, but I think it addresses some of your, well, it's relevant. Right now, one of the more promising forms of housing is housing that's built off-site and is modular. Like Huntington Homes, are you guys familiar with Huntington Homes? There are others, or panelized. There are other techniques that are really interesting. The problem is that off-site modular homes are still not cheap. They're faster and they're great for the labor force because you can keep the people employed and they don't have to kill themselves at prematurely age in the winter. But they're still expensive. Then on the other side, we have people all over rural Vermont who would like to build 2, 3, 4, 5 unit projects. But if they can't get any quantity reduction because their orders are so small. So our bill contains a housing accelerator that will allow the Department of Housing and Community Development to act as an aggregator and aggregate a whole bunch of small orders from rural Vermont into one big order. And then go to Huntington Homes and say, 40, we want 40 of this type. And the testimony is that will bring the price down, not way down, but if anything helps. The problem is, the great thing about that project is that the state doesn't have to pay for those units. It doesn't take taxpayer dollars. It's going to be paid for by the developer. But the problem is, it's one thing for the developer to say, sure, I'm good for 4 units. But you're saying to Huntington Homes, how about opening a new line for these 40 units? They're going to want to know absolutely that the money is there. They're not going to do it just, oh, well, you've got 20 little developers out there. So the treasurer has agreed to use part of their 10% for Vermont money to create a credit facility to just backstop that order. That's an example. I know it's kind of in the weeds, but, working with credit facilities, and we've also have a bill to increase the 10% for Vermont to 12.5%. So we're trying to make more money available for all kinds of things. Long-winded, my apologies, Matt.
Okay, it's complicated. There's a lot, and the state isn't going to be funding every kind of housing process.
Yeah, I mean, there's no one solution.
No, there absolutely isn't. So thank you to you and your committee, and we'll look forward to the
We'll get it.
revised
Yeah,
version. And so appreciate it.
Thank you.
Thank you. So committee.
Tiff, thank you for being our correspondent.
All right. We have the floor at 3:30 budget adjustment. And I don't know what else is on the floor.
Couple of those. Postponed.
Tip? Tip is on the floor? The other kind of tip?
No.
Oh, do we have?
Oh, it's
Oh, they're singing. We all have to be there for the devotions. Thank you for the reminder. Tomorrow, we are going to, we're going to vote on the animal cruelty bill, H578 that we heard yesterday, and we'll know who's presenting that by tomorrow. We will talk about H660, which is the opioid bill. Tip has some other things to talk about. We're not going to talk about it today. We've run out of time. That's fine. So we'll talk about it tomorrow. And so we're probably not going to vote on it tomorrow, but there's another proposal, and we won't go into it now, but there may be an amendment we've been something for the committee to consider. But we are going to hear other bills, the Labor Relations Board that we just heard from Chair Mahali, the Sister State Program that came from Commerce. We're now going to be looking at that, and a dam safety program. I don't think Sister State has money. I haven't really looked at it. The dam safety does have money, so we'll look at it. We won't be voting, or eventually if we vote, we may strip the money out to do that usual sort of thing. So at this point, we don't have anything after lunch.
That was my question. No votes after lunch?
No votes after lunch.
On the internet then.
Well, we try to meet after lunch when we can, but there's a. I have an NCSL meeting from 2 to 3, so I won't be around then, but at this point, we don't have anything. So you'll get to be done after the morning, and then you get to start break.
Oh, my.
Bring home all your stuff. Wayne's already rented an extra truck to bring home his materials. And whether or not I'm in town, I will be available, accessible, and I may not get back to you within 5 minutes, but I will be available then as well. So will JFO staff. Lynn?
I have a question.
Yeah.
They got rid of this year, the federal mediation service. What happens when you move on to the school boards?
Right. That's what we used when we were school boards. That's what we always used, was the federal mediator system, because it was available and the federal government has gotten rid of it. So I'm guessing that schools are now gonna have to pay for that.
Higher
Well,
price.
Yeah, they might have paid for it anyway, but
No, they didn't.
they split that. Back
The federal mediator was a pro bono job. They got paid by the federal government, not by the.
Everything.
That's gone away. For schools, for everything. It was a very important. All right, we are on starting at 9. I know that's a shock. It's been 9:30 this week, but 9